So, to each their own treatment. So this, we've heard a lot this morning. This is a passionate discussion. There are things that have to be done, things that we have to do right away to really handle the patients with the resources we have today, and not just to simply treat them with technical measures. We have other things that are necessary, and so that's why I'm going to ask you, what are the conditions that you will treat your patients? And how do you want to ensure that we give you the innovative, therapeutic, explorational, functional tools so that this patient's pathway will be a fluid, smooth one? What are the ideal conditions that you would like to have for patient care? Yes, well, patient care is not just at the heart of what I do. I really work more in the area of research. However, what we're trying to do for the research pathway is something that we can actually apply to the healthcare pathway. I do not come from the world of the health, but from marketing world and digital and experience marketing world. Now, to define these experiences is something that is co-developed. And so what I would like to see happen is to have this co-development for this whole pathway, which is that regardless of whether we're in the healthcare area or the research. So this co-development will really require this cooperation and consistency of different actors. Now we have these three actors that are available for this, for the world of patients. So we have the companies that are actually producing health care products, drugs, etc. And we have also the doctors have to take into consideration now not only all of these innovations, but also what's really essential is how can we co-develop these relationships to make sure we have the most optimal treatment. Now, Laurence, in the different supports that exist today, there's an important one, which is data. We could not develop these research protocols and healthcare pathways if we don't have the data, if we don't have the possibility. In fact, I just want to make a point. I want to distinguish, we're not going to be talking about gadgets, artificial intelligence, but what I really, do not call them gadgets. But in fact, often, I do remember that there has been Gérard Raymond one day, he was talking about the healthcare, everything that's been set up for the diabetes. He says there's tons of applications. If we have maybe 80% that function, that's great. Sometimes just 3, that's not bad. So that's why I use the word gadgets. Now we're going to be working on data. Well, you, as a company that creates data, now tell me, and how do you manage this? What are the services that you can give to Guillemette and to our patients? Yes, first of all, I would like to go through a point. It just is like when you install a microphone. When we're talking this morning, we're talking about to predict. It sounds something that's very simple, but that's not the case at all. I do think we were politically correct in the morning, but maybe now we can try and be less politically correct. Let's be concrete. Now, data, we are often known because we do this, make these medical products available, and we do equipment. So a lot of what we do is related to data that comes from the equipment. We also were talking about a lot of platforms, connected objects, and we have enormous amount of data which is within the hospitals. In fact, we were talking about this. We had a workshop on this point yesterday. And our data, in fact, it has to be well constructed. And this is a point that we haven't spoken about very much earlier. We're saying everything's going well. That's we say in a nutshell, we just say everything's going well. We have an enormous amount of data from all the different hospital centers. Now, how is it structured? How in fact, will this data be organized and you can have interoperability of this data? Because you have the structuring, you have the quality issue. You can have a lot of data, but if it's not of a good quality, well, then that's a serious problem. How can we communicate together? And how are we going to use this data? We have 97% of the data which comes from our equipment now, which are not used. So if you have a lot of data, but that's pointless if you don't use it. So what we want to do, we want to work all the different actors. In fact, Mr. Kouchner is always there. And as he said, we must work together. We work with different patient associations. I think you would say that, and their applause is well merited. We also are working with Olivier and how we can group together, working together to be certain that we will be able to contribute with coming up with solutions, because in fact there are lots of different persons working in a silo, but no, we have to work together. I believe what we have to do, just like in a company, we have to say, if we work alone, we're going to go very quickly, but we have more chances. If we work together, we can have an appropriate solution. What I've heard this morning, you have a lot of theory, but now we need a pragmatic approach. What we're trying to do is to have cooperation that's efficient. We are lucky to have plans, R&D in France with lots of competent persons. We work with the best in the area, in the hospitals, to come up with solutions, to have precise precision medicine, which is the right treatment at the right time for the right patient. And that is really the aim that's important. Yes, with the best, it's not always a doctor, it can be other professionals in the health world that can also help in this co-development as we would like to strive for. Olivier, drugs, when we talk about health, we talk about medicine and drugs. I think it's very good that things are advancing differently, that now we can see there are different tests, different kinds of diagnosis tests, drug tests. We also, in the second part of this roundtable, we're interested, in fact, I think there's this question, which is a basic one, which is access. This is a problem in France. In fact, we had this early access, which is not understandable for the different world, the people outside the medical field, and this issue came up on the board. Now, there's another subject we'll be talking about in relation to access. How do you see, in fact, the concrete arrival of the patient, a very fine-tuned treatments that cannot simply just be driven by put this product on the table, and then they do it, they take care of it, but it has to be taken into consideration. It has to be part of this pathway, and not all the professionals are actually trained in this area. And in fact, sometimes the hospital can be a break, an obstacle to some of these products, which is a prophylactic product from the COVID concerning this immunodepressed patients. We have 25,000 actually that are treated, and we need twofold numbers of this being treated. And so you have all these deaths when they are being reanimated because they're immunodepressive and the vaccination did not work. So we have to find other solutions. We have to find new ways of coordinating. Now, the industry, pharmaceutical industry, in fact, when it looks at with its capacity of research and creativity, how can we actually create this world that will be able to have the data combined with the different consistency and co-development with the patients? Thank you. This is a long question. But I'm still going to answer. Okay, you come with your questions, I come with my answers. Okay, so I'm going to answer the way I was anticipating your question. No, it's very interesting to listen to your question. So, seriously speaking, as Laurence was saying, this precision medicine is the right treatment for the right patient at the right moment, and Pascal will be talking maybe the right treatment for the right patient at the right time and at the right place is what I like to add, because this gives us a notion of accessibility and obviously for the territory. And this is where we can intervene the right time. You also have this notion of data. So the right time is early diagnosis when we have a curative approach. It can be monitoring of the patients so that we can see what is the right time to intervene for a cancer. It can also be in the case of infections. This Professor Vincent Maréchal's project, LIPIN, is an analysis of these different residues and to get all these different environmental, etc. factors can help us to predict and to have the right treatment at the right time for the right patient. And I would like to add, based on what we heard in the morning, the round table. In the round table, I'm hearing we have to do things together. We have to co-develop together, co-develop, etc., etc. Now, when we want to do things together, and concerning health data, you don't have 10,000 solutions. You have 4 different health data storage which have been validated. And we have the French Association of Cardiology, we have the INCA, you have Clinique 6, and now we have this Agora Santé or Agora Health Consortium. Now, rather than saying it's good that we do things together only, I would like these participants, including the Curie Sanophile and Manakoff, to join this Agora Santé or Agora Health. This would be for the data aspect. Now that's done. Okay, ready for the next one. Now the right place, this is the territory. This is sometimes, it can be remotely or a distance. And then here the pharmaceutical industry and others can also play this role, specifically with the general medicine, as we've heard today, is to improve the health pathway with different digital solutions as well. Why not? And also a pragmatic approach and getting rid of the silos for different illnesses that can be diagnosed in the cities and they can be treated in the cities, and so we can then be organized in the territories, like labs too. Now, this territory notion is very important because now, when we create, for example, a meeting with the different actors, you have a provision of these different territories, which is tremendous, and very generally speaking. So the centralizing is the Paris, the Jacobin heritage, and this gives the impression that we're going to have the same solutions rolled out everywhere. Now, in this notion of taking into consideration the territory, you really have something that we have to really investigate more in depth, and this is where you can come up with innovations. In territories, you have those who treat the patients, and Pascal, and this point, once we have the data, and once we've succeeded of having a system, maybe by Agora, which will have an integration effect, how with these data, with these treatments, with this mobilization of different health professionals, how can we get this aim that we're working on? Yes, we are very lucky. We can see the different considerable progress concerning different healthcare measures. We have new drugs, we have new data, where we see this progress, which is really tremendous. Now, the different genomic advances in other precision medicine already is something where we can see a lot of progress. The difficulty, and we're here to discuss this, is how can we integrate all of these data, which are used for personalized healthcare, without really ignoring the person. And this is the person in their own environment, in their territories, in their emotional life, etc. This is a challenge. In fact, I've gotten into the precision medicine through genomics. I believe that we have to extend this area because we have 120 drugs in France which are authorized on the market, and they, for example, they really respond to different genetic anomalies and cancers. Now we have to use it, but we have to integrate these also areas of the system. We do have a difficulty because it's almost a human one, which is today is to embrace this broad area spectrum. And that's why and as we heard this morning, it's not just the doctor. It's today the healthcare system, because of this multiplicity, we have the precision tools. We have to involve other actors to really have a personalized treatment. I would like to also mention in that regard, you have to really look at the patient in a holistic way. And the more personalization we have, we'll have to question the patients about their lifestyle, also citizens, and broadly speaking. Today, this morning, we're talking about health is not just a matter of patients, but citizens. Now, in the way things are going now, we are not always equipped with the right tools to really involve the citizens in research, and that's what we're trying to do. At Seintinelles, we're doing simple things. We're talking this morning a lot about going back to the basics. I do relational marketing. What I do at Seintinelles is just to really send emails. And really, from a technological point of view, it's really 0 0 degrees of really low tech is how I want to put it. So we have generated 45,000 answers in just 10 years for our research with very limited resources. And this is done thanks to the relations, to do things simply, to say hello, to say thank you, to take into consideration the results of different studies. This will enable the citizens to be more involved in research. And this will enable you to really have a customized treatment. In fact, this point is very important. I don't know if we have Nadine Rothschild in the civic education, but to say hello and thank you, this is something that really is very important. In fact, researchers didn't always necessarily have the means. They didn't have this direct contact that was that easy. Now, with the digital, we can really have this measure taken. How can we reduce this contact time when we now see someone at the hospital, for example, to find a doctor, even at the hospital, to have information concerning his health? It can be very complicated. So if we can find an intern or even the head of the department at the hospital, it's very difficult. But how can we reduce this time factor, the time for, how can we have quicker connections between people? I'm not sure if I really understood this question. So in fact, we have different systems. We could be communication systems like you use, and they will enable us to think that we'll come up with solutions for simple dialogues between doctor, patient, family. I forgot about the family in the complex pathology conditions, but now it's not really what is done. So in other words, are there solutions that you see which will enable us to simplify these relations? Well, I imagine that digital can offer different solutions, but I did not really think about it under that angle because we're thinking about from the angle of research more rather than healthcare systems. But I imagine that there are digital tools that will enable this. So Guy also was talking about this morning. So maybe there is this evolution in skills and responsibility, increase of different actors. For example, the different dispensary pharmacists, and this will help. We can have more of a proactive and responsible approach. You were talking about artificial intelligence. Let's talk about artificial intelligence. I think also it's a way to really give doctors certain time that they get away from these administrative tasks. If they have more time, for our medical staff have more time, then I think this will help us to have a better relationship with our patients. And we were talking about this yesterday, is also to explain to the patients what is the purpose of data. Sometimes we forget this data. We are afraid of what we don't know. This is something very simple. If we enable the patients to understand what we do with data, we can get their consent to share their data. That can enable us to accelerate. So I think we really have to really work on that so we can have a better exchange with patients. So this can really help us have more time. We can have less administrative tasks thanks to these technology. And also, we have systems and companies that really take too much time. And this is one of the points brought up by our teams and also by a lot of people that are in the healthcare profession. So really, it's hard. All these administrative tasks take away from doing our real jobs as health professionals. So we are in a country, and I was talking about administration, we have a lot of administration, a lot of control, a lot of standards. Even so standardized, we have this legislative system which has all these constraints. We have this all these different legal codes, so many of them, as you can see, as I'm indicating with my hand. You know, it's really, as you can see, we have these piles. To understand all these codes, really, it's not easy. Now, this, contrary to what we think in the territory, does that really favor? Is it more favorable for access or not? I would like to have your point of view. It does open up a discussion, not only a current one, potentially a controversial one. This morning, we've heard about a futurist. Interesting to have a future vision. I would like to be someone like this. The problem is, I am on a daily basis, I have to go to my sad reality see being there present on a daily basis. And in that case, in my case, we have this administration in the health area, which sometimes is really dogmatic, systematically you have accountable, and it really is based on this simple equation, which is precaution plus suspicion equals diabolization of innovation in industry. It's simple as an equation, a simple equation. And so in this case, we do have these delegates from the insurance that will go visit the medical cabinets, and they don't prescribe certain innovative drugs. We have these health agencies that will actually limit the use of certain controlled drugs because they will not be used correctly. So we made three. We have the reforms that we made, except we have the pseudo reform as well. We just seen the text, and then we go 10 steps backwards because we have these all these different decrees, and it's hard to have all these decrees. And we have we also have this resistance against innovation, and for the PLPSS. And so if we talk about the patient of tomorrow, and I'm wondering if we maybe what are we doing about this? I just wanted to. Just to really take Olivier's opinion, because I'd rather be a futurist rather than present on the daily basis, like you were saying. Now, what we need to be careful about, if we have a futurist, I think you're right, we have this population that, in fact, will be taking the resources, there's an advantage of this. Some people will really take up this modernization, others will be left behind. So we as industrialists and as healthcare professionals, we have to make sure that we don't leave anyone behind. And that, in fact, is where we have those administrative part, which is really unbearable. But I think there are some solutions if we really have a futurist approach, but we might leave a lot of people lagging behind. So what can we do? We have a social role, and we have to not forget that this is a real problem, and we don't want to enter into all this problem equation. When I listen to, we have to reform completely the Ségur. In fact, I used this on Tuesday. We wanted to keep everything that we had and put another layer on it, but maybe we just have to reconstruct and not just be adding another layer. Now, if we go back to PLFSS, did you find it? You found the positive point. Yes, I did find this positive point. Now, okay, don't worry, Olivier, just to make him feel better, because in fact, yes, it's not, the positive point is concerning innovation, because you're right, Laurence, innovation, you have to be careful. If we don't make it available to the patients, then that's not good. Innovation is to demonstrate something that works in the present. And what I found not bad in this special project of the PLFSS, which is the legal program for financing the Social Security insurance. So when Olivier was talking about wastewater, what we were talking about? We're not talking about other residuals. No. What are we talking about? We're talking about something which in 2015, so that we could have the patients benefit in terms of innovation. Some of the tools for biological, pathological diagnosis that are modern, genomics and other examinations, and these were to benefit the patients in 2015 by these different platforms specialized in this area. Since 2015, the establishment of the beneficiaries saying those who were prescribing them for their patients could have a reimbursement by these insurance agency, which are, because they're thanks to innovation. And we had this tests which are indispensable. We're not in predictive medicine. We're in the daily cancer, lung cancers, etc. cancers. We need these analyses that are really determinate for the benefit for these patients. So in some companies, these tests, these genetic tests, should be actually in the insurance scheme, health insurance scheme. You can see the benefits for the different treatments. Now we see we had some evaluations that were looked at concerning the different benefits concerning these different exams. And this we will have in October, we will have these assessments. What we, thanks to these institutes, when we look at this this act, legal act, there is this will to really connect this with the examinations, but there's counterbalanced by these technical terms. We have 356 diagnostic exams of the RNA, and we want to evaluate 5 in 2003, and to have so that 2.5 also be reimbursed by the health insurance. You have to have the glass, you have to be a positive. So we talk about having a glass full. Now, here at this stage, I think we have to find what the golden nuggets, because the list is going to become very quickly obsolete, because tests will be obsolete. So I think it's very important today that these different genetic exams and others, it's not just genetics, in this RNA area, we also have problems of this test. I wanted to give you an idea concerning the benefits for those that are not familiar with in the area of cancer. You have these serious cancers. 1 out of 2 has this mutation. That's why ovarian cancer is very serious, ovarian cancer. You have women who have developed this ovarian cancer. 1 out of 4, they have this marker. So the prognostic is 30% of survival for a 3-year period in this. But we do have a vaccination. No, that's for the uterus cancer. No, wait a minute, Olivier. We have medicine, drugs for that. Now, when you have detected the markers and you give them drug, then this is a targeted treatment. So then the prognosis goes to 62% for survival in this 30 period. So the special test, which will be essential for the breast cancer, because we have the same demonstration for breast cancer, which is the early detected breast cancer. So this test is important. The screening is important because it goes through this special mechanism. It's very urgent, not only that we can statute with a favorable opinion, but that when you have this early diagnosis, that works very well, and that really is very important. It reduces the time, reduced to get this molecule, have access to this molecule. So we have to ensure that we can have this nomenclature standardization. It took 2 years to really have it covered by the health insurance. Today, we have real chances for survival that can be more favorable thanks to these points. What can we do to improve, to have a smoother measures so that we can have this impacting the daily life, so that people can benefit from these? We are always confronted with this. We had all these different institutions that are involved in this different chain, and just like all the different saying, we hear that some institutions are saying this is too expensive, then we come up with a decree, but then the law takes, then you have to have the application. So look, it's a whole time-consuming session. We were talking about this. There are a certain number of legitimization, and so that's why we have to do this work of legitimization concerning the real daily life, because we see in the clinical tests, this concerns a lot of patients, and female patients in this case. And so to focus on this early detection, and it means the capture of getting the special data, which is connected with these different evaluation records. And this would be really getting this early detection would be a step ahead. We were talking today what created this special Gilets jaunes accidents, these demonstrations in France. We have so many new cancer patients in France, and that was why we had these demonstrations. That's one of the reasons. So do we have I don't think we can do what you're saying. In fact, it shocks me what you're saying, because I do think and I would take my own professional area. We do a good jury, and we try to accelerate things. We want to find ways to accelerate, and we were talking about drugs. We could also be talking about equipment. We do have patients. We have 400,000 cancer patients. So I'm not talking about other diseases. So we have funding. Okay, I realize that. But still, it will be more expensive if we don't deal with this. And so you have specialists in this room. I think we have to do really a medical economic approach. Now, this is an important sentence that you said, going beyond biomarkers and genomic tests. There are also, as we've heard, the different creatinine, which are not in these standards. We have 5 million who have this specific disease. I would like to come back. We identify the different obstacles. We are talking about the different derivatives from the system. We have the schizophrenic situation. You have the humanity and the technical aspect. When we are a patient, when we are with someone who's suffering, we need these two approaches. Do you see in the years to come, do you see, is this part of the different, for example, companies like Astrazeneca and others, do we not need to create something that will enable us to have a closer tie, not just to give cold tools like data, drugs, which are maybe efficient, but what can we actually have contact connections so that we can develop products which are what we call convenient products when they're done by Apple, but could also be convenient for the healthcare pathway. I do think that it's a very broad question, and if I could, well, it can be very complicated. There was something that when I went to GE, when I joined GE, there was a different IRM when children were waiting before they took the exam. At Neckar, the hospital for children, I said, we bring humanity this way. And I think this is by talking and thinking about the patients when we develop our products, in fact. And this is something that we talk about when we're talking about, I think, how do we really integrate research with the patient and how we can continue to integrate it with all of our different processes, all the way to making everything available for them, these treatments. We, at the beginning of the year, we're going to work on this, and there's the difference in the division is to really integrate the patient in our vision, which wasn't the case before. We need the special mindset, a corporate culture, in other words, really to our way of really producing our products. Everyone has to change their attitudes. I do see this in research. We do have a change that has to be made with the researchers who, in fact, you have to stop that the researchers take a position as being those who will be directing everything in the study. In fact, a researcher in the future, maybe this will seem a little bit really a reductive approach, but I believe these researchers have to be to really guarantee a serious methodology, and the rest has to be co-developed. And the researcher is not necessarily the one who has to really do everything in the study, but he is the one who will really ensure the methodology. On the other hand, the side of the citizens, we also have to change our attitudes, not personal stories. We're not there to really talk about our personal experiences. We're there as citizens. We're participating in protecting something which is the common good of all. We have to be committed, and it has to be a long-term approach, not just by answering a questionnaire, even though it's useful to answer a questionnaire, but we have to be committed. We have to have these long-term co-developed constructions. We need this change in approach, and we have to really educate one another. This should be complementary, and we have to educate each other. What is your opinion, Olivier? As you were saying, our role going beyond the drugs, in fact, our role, I would like us to be taken as public health actors, because when we're involved in different illness, we have 4 key pillars, which is prevention, the early diagnosis, and the follow-up when there's a treatment, and for those who rehabilitation when necessary. There's all this work to be done. So each time you have the patient in terms of prevention, citizen approach, the early diagnosis for these curative areas, and also the continuity of the treatment for the control of these chronic diseases, and then going back to production productivity, back to active work life. And all of this can play a role. And once again, this is this famous public-private partnership that's very important, this opening that is really essential. Pascal, how can we integrate this role of civil society, patients, companies with service so that we can do something which can be something that can be beneficial and virtuous? In fact, we're talking about a situation, we'll be spending our time actually doing laws, and we don't let certain professionals coming up into our hospitals, so certain innovative products are not entering to the hospitals because the hospital staff don't know about them, because these innovative products are barred from coming into the hospital, and community doctors didn't know about this. So how can we integrate all of these actors as well within the healthcare professional staff? So how can we can have something new and efficient? So we, as Guillemette was saying, how we can have these benefits. Well, a long question. Okay, the technicity and humanity. These are important issues revolving around patients. So we, as Guy was saying, Guy has very well seen the technological advances, and he was asked a question. Now, is this telescopy, is it done with empathy, support for the patient? I don't believe it is. And the complexity of the different analysis of data, genomic data that can help us analyses, should not keep us away from the patient. I'm not just talking about empathy, but also the quality of the healthcare. In fact, and with the information, I'm not a fan of tools. IT tools and the emails are not appropriate for discussions. I'm not a fan of these media tools to talk to the patients, because if we want to personalize, then we really have to have another dimension, which does not transpire if we don't have the person in a face-to-face release it, because for emotional, intellectual, social reasons. I do not believe to exercise this kind of very specific area in genomics. I, in fact, really very rarely had this discourse concerning mutations, etc., etc. We use these words, but what I'm concerned is I don't believe that the complexity today of our precision medicine tools are an obstacle to personalization and to having this humanity to take care of our patients. So, in other words, a lot of things are open, a lot of things need to be developed and set up. It's important now. Now, and what is the time frame? So, Agoria, when will be efficient? Agoria is efficient already. So, if the consortium will be full of members who want to really input data in our better days, we can also work with other institutions. We, Astrazeneca, we for COVID-19 and breast cancer, we have played an important role. And so, to have an enriched data, it's very important. It's important to have members joining the consortium. We can do things together. Well, we will be giving some time to Guy to do things together and really do them. And now.